why for most women, looking good and feeling confident go hand in hand. And that's why breast augmentation is one of the most popular cosmetic surgeries. But there are many concerns women have with the procedure and with the operation. Dr. Kirk Moore, a plastic surgeon with Genesis Medical Institute, has developed a revolutionary breast augmentation technique. How is this technique different?
Well, there's four things. One is the way you kind of go into it. If you expect 2 weeks of pain, you're going to get 2 weeks of pain. If you expect to be up and out in 24, 48 hours, then that's what you're going to achieve. Second thing is the way I do the procedure. I don't get any bleeding. I cauterize all the blood vessels. I look at everything under direct vision. I'm not kind of putting a blunt probe under there and ripping and tearing the muscle out from under the chest.
So not as abrasive in terms
not
of
as
the
abrasive, you know, just a little bit less traumatic, I think, to the actual tissue area that that we're working in. The third thing is the anesthesia that I use. I don't use any narcotics. I don't use any gases. There's very little hangover effect. You're up and out, out of my recovery area in about 45 minutes. And you feel pretty normal. You don't have that hangover kind of just lethargic effect. You don't feel like you need to go home and sleep for the next 2 days.
So the recovery is quick.
And the recovery is quick. And then the fourth thing is what I do post-operatively. I think one of the biggest functions of pain is muscle spasm. So I'm having you move, I'm having you stretch, I'm having you exercise. Again, you're showering within 2 hours. I want you washing your hair, I want you blow drying your hair, I want you laying on your stomach the next morning. I want you doing all those things that's going to kind of create stretch of that muscle so that it keeps it from going into spasm.
October, of course, Breast Cancer Awareness Month. Right. And I think another concern for women is that breast implants might affect or inhibit the ability to detect breast cancer. Is that a valid concern?
It's a concern, but it's actually been studied a number of times, and that has not been shown to be proven. As a matter of fact, and they don't know if it's like a selection issue, but actually the risk of breast cancer in women that have breast implants is actually less than the general population. Probably because, as a rule, the women that come to us for breast augmentation are generally healthier in some ways than a lot of other women are. And so there's, so there really isn't an increased risk. And sometimes in some women that are very small to begin with, you can't really do a mammogram on them. And so sometimes it's actually easier to get visualization of the breast tissue when you have something else that's out there that's kind of helping bring it out a little bit so you can get a mammogram or anything. Mammograms are not comfortable whether it's with or without a breast implant, but no, there's no increased risk.
All right. And you have an open house coming up to address this very topic.
Correct. We have an open house today for breast cancer awareness. We're donating money for every purchase to breast cancer research. We have door prizes. We've got, it's a big celebration.
All right. That's happening today where?
It's at my office on Redwood Road, 8822 South Redwood Road. And phone number is 685-2730, or you can go to genesisinstitute.com.
All right, perfect. Thank you so much for stopping by to tell us about it. Coming up, Bella and Edward's vampire romance is hot again with the release